Hello guys, hello friends. I'm Fidhelis Andhika, number student 42. Here we'll talk about medical devices that are quite familiar in the medical world and very easy to meet if we go check into the hospital. This tool is a thermometer. What is a thermometer? Thermometer is a device that is a medical device that can be used to measure a patient's body temperature. The term thermometer comes from the Latin meaning thermo, meaning heat, and meter meaning to measure. Types of thermometer. Thermometer have many types. But what I discuss is that only thermometers are used to measure human body temperature. The first, a mercury thermometer. A mercury thermometer is a thermometer made of mercury plates on a glass tube. Calibrate marking on the tube make the temperature readable according to the light of mercury in the glass, varying according to temperature. An example of a mercury thermometer is a clinical thermometer or body temperature meter. On the thermometer, the lower body of the pipe is made narrow. Number second, digital thermometer. The digital thermometer use metal as its temperature sensor, which then expand is translated by electronic circuit and display in the form of number that can be read instantly. Digital thermometer temp surface are divided into digital ear thermometer and thermometer gun. In order for the thermometers that we have to last, maintenance is required. Things to not include: pay attention to the glass surface of the thermometer. After use, immediately clean the glass from dirt or sediment that may stick with the cloth. Gently with the cloth. Store the thermometer after use in its storage container. Check the state of the thermometer periodically. Do not occur anomaly on the thermometer. How a mercury thermometer works. Mercury thermometer works consists of capillary pipes that use glass material with mercury content at the bottom end. For measurement purpose, these pipes are made in such a way that they are empty. If the temperature rises, the mercury will rise to towards the top of the pipe and provide clues about the temperature around the measuring instrument according to its predetermined scale. The general way of working is as follows. Before the temperature change, the volume of mercury is its initial condition. Change in the ambient temperature around the thermometer responded to the mercury with a change in volume. The volume of mercury will increase if the temperature rises and will shrink if the temperature decrease. Thank you.
Hello everyone, my name is Josephine Brahmaningtyas W.K, and I'm one of electromedical student, and my student number is 191313041. And today my friend and I would like to tell you about some of medical device. And now I will tell you about my topic. My topic is a medical cabinet warmer. A medical cabinet warmer have some same function like blood warmer, blanket warmer, or irrigation fluid warmer. A blanket warmer, also known as a warming cabinet, store and warm linens, blanket, and sterile intravenous and surgical irrigation fluids in a medical environment. Blanket warmer are often used to warm intravenous and surgical irrigation fluids to reduce the risk of hypothermia in patients following a surgical procedure. A medical warming cabinet can be used for multiple purposes depending your needs. Here are some of their functions. First is blanket cabinet. Blanket cabinet is used to warm the blanket before it's given to the patient. And second is irrigation solution. It's help to prevent preoperative hypothermia. And then intravenous fluids. It's keep the fluids warm, ensures the patient maintains to optimal temperature and feel comfortable during the procedure. And next is injection fluids. It's medical professional must have or must make sure it's warm in order to keep the body temperature and at the normothermia state for maximum recovery rate. And last is blood warmer. Because before you have blood transfusion, you must make sure blood is also warmer with medical warming cabinets to prevent hypothermia. It also allows the temperature to be safe for transfusion. So, if you have transfusion or infusion blood, the blood must have same temperature with the blood in your body. And now I will tell you how to use it or how to operate the warming cabinet. The first is put the blanket or anything you want to be warm. And second is pull the door cabinet closed and then press the button on. And next is you have to set the temperature and the timer, and let it like 4 or 5 minutes or in order to use. And then if it's done, the blanket or anything ready to use, like you can use it for blood transfusion or anything. And maybe that's it for my topic, and thank you.
Hello guys, my name is Meisya Gamatya Butar-Butar with name 1913133044. So here I will explain about cardiotography or CTG. The first I will explain is what is cardiotography or CTG. Cardiotography or CTG is a test performed to evaluate the specific condition of the fetus in the womb. This procedure will measure the fetal heart rate and heart rhythm. Cardiotography or CTG examination includes routine pregnancy tests. This procedure is carried out in conjunction with other examination for the presence or absence of certain condition experienced by pregnant women. For example, diabetes, high blood pressure, or other medical problems that can cause problem with the fetus. Okay, second I will tell you how does CTG works. CTG uses sound waves called an ultrasound to detect the baby heartbeat. Ultrasound is a high frequency sound wave you cannot hear, but it can be sent out or emitted and detected by research on special machine. The ultrasound waves penetrate freely through the fluid and soft tissues. Okay, however, ultrasound wave bounce back as echoes when they reflect more solidly or densely from the surface. For example, ultrasound wave will travel freely through the blood in the chamber of the heart. However, when bouncing of the solid waves, many ultrasound do echo back. Another example is when the ultrasound wave on the bile in the gallbladder, it will echo back strongly if it hits solid gallstone. So as different structure that the ultrasound cannot penetrate the ultrasound wave or hits inside the body due to the different then it send back echoes of various forces. And in CTG monitoring, a special type of ultrasound called Doppler is used. This type of ultrasound is used to measure structure that are moving, making them useful for monitoring the heart rate. Okay, why is cardiotography needed? The main purpose of cardiotography is to monitor the fetal heart rate. This examination can also evaluate the uterus contraction of the mother, which can describe the health of the fetus. Who need cardiotography? Every pregnant woman needs a cardiotography examination. This procedure is important during pregnancy and at the time of delivery. Doctor will highly recommend a CTG examination for pregnant women who have a history of the following. The first, estimate pregnancy of twins, state and age of pregnancy complication like high blood pressure, diabetes, hypertension, hypo or hyperthyroid, and chronic infectious. What are the preparation for undergoing cardiotography? There is no special preparation before you go to the cardiotography. So, how is cardiotography done? The CTG procedure is similar to an ultrasound examination or USG of the abdomen. Broadly speaking, the procedure includes the doctor will apply gel on the pregnant woman's stomach so that the monitor plate that sticks to the skin will give a good signal. A fetal heart rate monitor will be placed on the mother's stomach. This tool is an elastic rope with plates at each end. One plate monitors the fetal heart rate and the other plate measures the pressure in the mother's stomach. Placed on the mother's stomach. This tool is an elastic rope with plates at each end. One plate monitors the fetal heart rate and the other plate measures the pressure in the mother's stomach. Okay, what do the result of cardiotocography look like? Cardiotocography examination can show the fetal heart rate. Here are the values. 1. Normal fetal heart rate. The normal fetal heart rate is 110 to 160 beats per minute. 2. Abnormal fetal heart rate less than 110 times per minute, more than 160 times per minute. Abnormal heartbeat pattern or rhythm. The fetal heart rate does not increase when the fetus moves or during contraction. What should be done if the cardiotography results are abnormal? An abnormal cardiotography result may indicate that the fetus is not getting enough oxygen. To overcome this, doctor can do the step below: changing the position of pregnant woman, give fluid stroke and 4, provides oxygen, provides drugs to relax the uterus and reduce contraction. If the treatment does not show improvement, the doctor may consider giving birth immediately. When the opening is complete, the doctor may use special forceps or vacuum to assist in the birth process. But if not, the doctor might consider a cesarean section.
Okay, so much for me. Thanks.